Welcome, everyone. This is another wonderful Weber training teleeducation session. And today we're going to have the great opportunity to learn all about the sanitation economy and public health. My name is Michael Lindenmeyer. I will be your host today. I am a director over at the Stanford School of Medicine and have had a long affiliation with the Toilet Board Coalition, and I'm a great fan of Alexandra Kanesevich. And so today we wanted to also thank our sponsors who make these infection prevention and control lectures possible, and this includes Diversey, Virox, Gamma Healthcare, Curel, the World Health Organization's Infection Protection and Control Global Unit. So we thank them for enabling these to happen, and we are also very privileged to be able to have today Alexandra Kanesevich, who is the Director of Operations at the Toilet Board Coalition. She is extremely well-versed in all things around the systems of sanitation. And when we think about infection protection and infection prevention, the actual very first front line of all of that is to make sure that you have clean water and the smart and intelligent management of waste, which Alex and the team have now removed as a term and talk about it as a resource. And so we're really excited to welcome her today. Alex, the floor is yours.
Well, thank you so much, Michael. It's wonderful to be with you here today and wonderful to be with all of you. We're really appreciative to the opportunity to host this session today. And absolutely, if you do have questions throughout it, feel free to note them. There'll be an email address that you can see on the final slide. We would be more than happy to welcome any questions, and we'll make sure they get to the right team member. So we'll start on slide 2, which is why sanitation. So when I explain the work that I get to do with the Toilet Board Coalition, many people's first question is why sanitation? And probably for most of those participating on this call, you might know the answer to that, and Michael certainly alluded to it earlier. But in many cases, almost 60% of infectious diseases can be prevented by proper and safely managed water and sanitation and hygiene. And I'd imagine you all know that better and may even have a more precise statistic, but that's from what we've seen. And this is a huge problem. Nearly half of the world's population does not currently have access to safely managed sanitation. And as you see, there is sustainable development. So the UN Sustainable Development Goals, goal number 6, is focused on water and sanitation and hygiene, and 6.2, which is our main focus of the Toilet Board Coalition, is universal access to safely managed sanitation. And what that looks like on the slide, you see a visual from the World Health Organization and UNICEF from their joint monitoring program. And this was published in July of 2021. This is kind of the latest numbers of globally what the sanitation and water scenario is. And as you see, 3.6 billion people don't yet have it, but also, we are making good progress. We are increasing our speed of people that we are providing as a global population safe sanitation to, but we need to accelerate more in order to achieve this by 2030. And so you can see some of the statistics around that on your slide. So moving to slide 3, this is why the Toilet Board Coalition was created. We were founded in 2015 by multinational corporations that were looking to unify and collaborate better in their contributions to this global challenge and crisis. And they were each working in an individual context, sort of through CSR projects or different programs with a variety of partners. And they said, well, what if we united together as a coalition of private sector, business-minded individuals to build up what is that private sector contribution to this global challenge? Because many of the businesses that we've worked with have a vested interest in universal access to sanitation. So it's not just marketing, or it's not just a CSR project. Often cases, if you think, for instance, Unilever is one of our founding partners, they sell toilet cleaner. And so they would really like more people to also have toilets because that's good for their business. And this might seem at first glance like maybe not a good thing, but actually we advocate that it's an incredibly powerful thing, because what it enables us to do in our activities and in our programming is to really engage with the full spectrum of the team of that company, and to harness their strengths in a way that if it's just a marketing program, you're not going to do. So we were created to scale up private sector engagement in SDG 6, universal access to water and sanitation. And how we do that, I'll get to in another moment. Moving to slide 4, I thought since you could only hear our voices, it might be nice to put a face to it. But Michael's on the left and I'm on the right, and we've worked together for many years and are great friends, and are really happy to be here with you today. Moving to slide 5, with this mission, we uncovered in our first few years of work, so we've been around for 6 years, and in 2017, we framed this approach, or this sort of system of thinking about sanitation as the sanitation economy. And a big focus for us in our first 5 years of operations was transitioning people's perspective of sanitation from something that was an unaffordable public cost to a potential business opportunity. So traditionally, sanitation has been tackled through philanthropic funding and donor funding, and it's been focused on providing access to sanitation and providing toilets, but with not a lot of planning or systems put in place for cleaning a toilet, fixing a toilet, or using and treating the waste that is captured by that toilet, or looking at the information in that toilet. And all of those things are actually really interesting business opportunities. And so as we've focused on how do we transition the global perspective of sanitation to be one of a business opportunity, we came and landed on this framing of sanitation that presents it and looks at it as a marketplace. And so we're going to come back to this infographic, as you've probably seen in the slides. We're going to come back to it a few times, because this is a really big part of our approach and why we do what we do. But first, coming to slide 6, I wanted to introduce to you the 3 economies. So that's each of the 3 major circles of the Venn diagram. So first we have the toilet economy, which is products and services that provide that safe toilet access for everyone, everywhere. So it spans centralized and decentralized. So that could be a sewer network, non-sewered, high and low water tables. Increasingly, we're looking at climate resilient wash technologies, low income to high, rural, urban, and peri-urban contexts. But also, very importantly, these toilet designs, and we don't advocate that there's a one-size-fits-all, or that there's kind of the magic toilet that will fix everything, but that these toilet designs are applying a circular economy perspective. So they are capturing, minimizing, and treating the waste, and that they're also looking at the opportunities to capture data and information from the toilet experience and from the operational procedures. Then second is the circular sanitation economy. So this is building on circular economy thinking, but applying it to sanitation. So if we look at the sanitation system, we don't want to see waste. So there's a great story that's told by one of the entrepreneurs in the field, and he says there are 3 kinds of secondhand tomatoes. So there's the tomatoes that fall off the plants in the field. There's the tomatoes that you maybe scrape off your cutting board into your compost bin. And then there's the tomatoes that you're disposing in your toilet the next day, hopefully. And so each of these tomatoes, there's nutrients in each of these. Each of these should ideally be treated in the same manner in terms of a biological waste system. Instead, we're packaging, for instance, baby's poop into a plastic diaper and putting it into a landfill, where really if we can be capturing, let's say, the baby's poop and integrating that into other biological waste, there's really valuable products that can be derived from this waste stream. And we don't want to be just flushing it away or packaging it and putting it into a landfill. We want to be maximizing the opportunity from that resource, which we currently maybe think of as waste, but that toilet resource, we want to be capturing that, treating it so it's safe, and transforming it into something that can be reintegrated into society and has value. So this plays a key role in the financial sustainability of the businesses operating in this space, that value, the waste and the value of that waste. But it also, of course, has very positive benefits on climate. So eliminating water pollution and methane emissions that come from untreated waste, and instead capturing a renewable source of energy, like a biogas, for instance, fertilizers, soil conditioners, nutrients, phosphorus is in our waste and is a very important nutrient for our soils and for our food growth. And so that's the circular sanitation economy. The third is the smart sanitation economy. And this is a rapidly emerging area, particularly building on the experience of the pandemic. This is a very interesting and exciting space that we see in the sanitation sector, but also starting to build that bridge, much like the circular sanitation economy is kind of building a bridge into agriculture. The smart sanitation economy is building a bridge into public health. And that is through, as you can imagine, smart sanitation, there are operational efficiencies that can be gained by knowing when a septic tank is full, for instance, or when a sewer is leaking, or where a truck is going, and making sure that it's optimized its collection schedule based on geolocation data. But also, there's incredible information in our waste about our health. And we've seen this through the COVID-19 pandemic, where wastewater-based epidemiology has become one of the key pillars to testing and understanding the infection rate in a number of cities around the globe. This has been used for polio for decades, but now we're looking at, well, what other information is in these public waste streams that could help public health officials and efforts to be more effective and to be more efficient. And so that's what we're focused on. That's one of the things we're focused on, which we'll certainly speak about more later. Moving to slide 7. So as I mentioned, we see this as a marketplace. And so one of the exercises that we've done over the years is to continually update that marketplace and to map who are the buyers and the sellers of these products, because this has been such a novel idea when we initially introduced it in 2017. We've seen a really encouraging transformation of the sector over the last 3 years. But so we have the toilet economy marketplace, and as you can see, we break this down to a few different business models for operating and cleaning toilets. And then, of course, there's a very important part of this ecosystem is also feminine care products and personal hygiene. Moving to slide 8, and then the circular sanitation economy marketplace. So this is focused on what are the products that can come out of this, or what are the primary products that can come out of this. So we have agricultural products, which is the nutrients, the co-compost. We also have treated water, energy products, primarily biogas, but also charcoal briquettes, materials for innovative products There are companies that have been working on, there's very high quality oils in our waste, and could they ultimately replace palm oil or other oils that are used in global supply chains? And then protein-rich materials. And this is a really interesting one, perhaps not for today's call, but there's a technology that's called black soldier fly technology. And the larvae of these black soldier flies love, more than anything, to eat toilet resources or human waste. And what that produces is actually a really high-quality protein that can be used as an animal feed. And if you're familiar with some of the global challenges around food security and livestock and all of the resources that are being poured into feeding livestock, this also poses, and fish, this also poses a really interesting opportunity that we think we're going to hear and see a lot more about in the coming few years. And then moving to slide 9, the smart sanitation economy. And so what we have here is primarily a look at that system. So what is the software and the hardware that's needed for the smart sanitation economy to a marketplace to develop? And so what we've marked on this slide is a number of the buyers and sellers that we see in this place, and the relevant businesses that could and in some cases do already have an interest in this. Moving to slide 10. So at the Toilet Board Coalition, we work in really 2 very specific ways. And so I'll briefly introduce those to you, and then we'll move into more specifically the smart sanitation economy and what we're looking at in the public health space. But we work in these 2 ways, and so that's the 2 arrows that you see on slide 10. We work with entrepreneurs. We run a business accelerator program, as Michael mentioned at the outset, and that works with businesses over a 12-month period for us to work with them as they strengthen their business. They go through a unit economics module, a pathway to scale, and then investor readiness. And we work with them to really get them to that point where they're ready to grow and they're ready to scale. And then secondly, while they're going through that accelerator program, they also are working with a corporate mentor. And so this is where that private sector engagement that I spoke about at the outset, this is one of the primary ways that comes through in our programming. So they're offering mentoring services to these businesses that are operating in low-income markets, providing sanitation economy products and services to low-income populations. And then secondly, we work kind of from the top down. So entrepreneurs are from the ground up, I would say, and the ecosystem work is from the top down. And what we're doing there is we're focused on catalyzing sanitation economy ecosystems through projects. We run innovation labs, we design strategic projects, and then we also publish a number of papers about the learnings and the insights from our work on the ground in these projects and with the entrepreneurs. And the purpose here is to really clear the runway for those businesses and clear the runway, creating an enabling ecosystem where they can thrive, their products can thrive, where there's an appetite and demand for partnerships. Moving to slide 11. What we've done really quickly, a look at that. So 93% of those entrepreneurs graduating the accelerator program are finding investment or a partnership with a multinational corporation through the program, specifically to scale their business. And that's actually our 2020 number. Our 2021 number is 97%. So that's something we're incredibly proud of. We've also, over the last 5 years, enabled 10 million of direct investment into those SMEs. 5 million of that was in 2020, and we've actually got another 10 million in the pipeline for 2021. So we're seeing a really encouraging growth curve in the sector overall, but in terms of the readiness of these businesses to take on commercial investment and to scale their operations and reach more people more quickly. To look over the last 6 years of the Accelerator program, we've worked with 45 different businesses across 12 countries. We, of course, track the number of individuals that they're serving on a daily basis, but then we're also looking at their CO2 emissions and their treated toilet resources, among some other statistics. Moving to slide 12, just a bit more on the Accelerator, because we're just incredibly proud of the businesses that have come through that program. So I think I've actually covered most of this already in the previous slide, but you can see some of the names and the timeline. Each year, we're really fortunate to receive about 100 to 150 different applications to the program. We select just 15 to 20, but maybe up to 30. This year, we selected up to 30 that were shortlisted and presented to our board. And then the board makes the final selections, actually. So we give as the team of the Toilet Board Coalition, we give our stamp of approval that we feel that business model is investable and that if there's potential there, that we could help them and strengthen them and get them to a successful place by the end of the program. And then the corporates, their employees, they work with us and they interview the businesses, and then they decide who they want to mentor. So the applicants have identified a specific need. It could be HR, product design, supply chain, operations, marketing. I mean, really anything you can think of that a business is encountering as it tries to grow. They can ask for mentorship on that. And so then our corporate partners look at those needs and look within their teams, and then they select who they would like to work with. And that's a pretty distinguishing factor of our Accelerator program because what it does is it really strengthens that corporate engagement. We're not just necessarily picking the best businesses that are ready to go. We're picking great businesses that are ready to go, but sometimes there are really fabulous businesses that don't get selected because their needs don't align with the corporate's priorities at that time. And so we encourage them to reapply, and we keep them in our network and do the best we can to support them anyway. But that's a bit how the Accelerator works. Slide 13. Slide 13 is just a quick look at that portfolio. We have a really strong showing and sort of network within India. It's been a big focus for us because of the Swachh Bharat mission and just the political will and momentum and investment flowing into sanitation in India. So in 2018, we decided to do an India-specific cohort. So we only worked with businesses operating in India. And then in 2019, we launched TBC India-specific activities, so their own program and business community within India. And so that has grown. And right now, we're looking at how we take the model of what we've done in India and apply that to other regions. Slide 14, I'm certainly not going to read everything that the entrepreneurs have said, but that's a few of them working with us. When they graduate the program, they have the opportunity to continue working with us and to actually join the coalition as members in what we call the cohort council. And that enables us to continue working with them and them to continue advising into our programming and for us to be showcasing their businesses well beyond the year that they work with us. I'm probably too personal about it, but I do feel like the Toilet Board Coalition is a bit of a family, and we're not so big that we don't all know each other in terms of within the coalition, and we're all very united together behind our mission, and so that breeds a lot of camaraderie. But once the entrepreneurs work with us, we do our best to kind of keep them in the family and do all we can for them going forward. So moving to slide 15, and I'll move through this one quickly. Actually, this is just the process that it goes through. So it's, as I mentioned, it's a pretty detailed selection process. So it runs for actually it's 2 years from start to sort of finish, basically from application to graduation, because we spend a year selecting them, and then they spend a year in the program. So slide 16, just to orient us in terms of the narrative of our time today, that's kind of the entrepreneur side to our activities. And so then the ecosystem side, which I'll go through much more quickly, if you look at slide 17, we work in primarily three kind of models, I would say. So one is an innovation lab. That's to work with earlier stage companies. So we designed and launched our first one in 2020. It's a shorter program. It's lighter touch mentorship, and it's specifically to catalyze market development in a particular geography, around a technology, around a business model, or a demographic. So in 2020, with Kimberly Clark's Kotex brand, we launched what we call the Women in the Sanitation Economy Innovation Lab. It's a rather long title, where we worked with 5 different female entrepreneurs who were operating sanitation or menstrual health businesses. And that gave us a greater, that will actually be a recurring innovation lab. And we noticed that we had a number of businesses applying to the accelerator program that were in that space and in the menstrual health space, but they didn't have the business maturity. They weren't ready yet for our accelerator program. So we didn't feel that they never made it to that short list because we didn't feel that they were ready for scale. But we didn't want to just leave that there. And so we built the Innovation Lab program model to help accelerate businesses in that space so that they could be ready for the accelerator in future years. And then scale projects, we've had, I would say, 2 major scale projects over the last few years. One where we partnered with the city of Pune, India, and the municipal corporation there with their Smart City Operations Center to bring their public toilets online and to start tracking the usage, the cleanliness, the hand washing, the humidity, a number of different metrics through their public toilets, and have those reporting into the city's, the Smart City Center, where they're also getting traffic information and data from the public health system and a number of other things. So starting to literally put sanitation on the map for them, mapping their toilets, and then having a reporting system that went from the sensors in those toilets straight to the city operations so that they could see when a public toilet needed maintenance, when it had maybe higher traffic, and perhaps needed to be cleaned more frequently. And then the second was working with the Ethical Tea Partnership with a number of tea growers in Africa and India to bring sanitation to their operations. So many tea communities do not have, as many agriculture communities do not have safely managed sanitation. And so we were looking at how the toilet resources coming from the tea community's sanitation system could be reintegrated into the tea operations. So how can that biogas fuel the boilers that are boiling the tea? And how could the fertilizer perhaps be integrated into the nutrients that are then being used to recondition the soil? So that was a project we've run from 2018 to 2020. And now the tea plantations are in the implementation stage, testing technologies. And then knowledge and insights, which will take us to slide 18. So this is the 22, I believe they're all there, reports that we've published as the 12 Board Coalition over the last 6 years. I'll bring later, I think we have a slide that summarizes the ones that are most relevant in the public health space. But these are all available on our website, which is www.toiletboard.org, in the resources tab. You can filter it to only show publications, and then you'll see all of these. And of course, they're free for download. So coming back to this infographic of the sanitation economy, what we wanted to talk about today was also specifically the smart sanitation economy and the health and public health opportunities that we believe could be in this space. And so we're narrowing in now, we're zooming in on the orange part of this circle. And moving to slide 20. So in earlier this year, we've actually launched what we call a roundtable, which is an exclusive business community bringing together experts in an area to support and advise and really even catalyze work around a theme. So it is really the bridge between sanitation and public health, actually, and bringing that community together for recurring calls 4 to 6 times a year to talk about and discuss different opportunities and ideas in that space. And so we convened our Smart Sanitation and Public Health Roundtable. And for us as the Toilet Board Coalition, our focus and a big part of the last 5 years has been understanding where is there value in the sanitation system that's not yet perceived or not yet capitalized on. Because if sanitation is a viable business, if it is a commercially investable business, SDGs, the market will ultimately take over, and we will accelerate progress on SDG 6 and achieve it by 2030. And so that's kind of our theory of change in very general terms. But so what we're always focused on doing in any of our work in kind of the sanitation economy or any themes that we're exploring, we're looking at where is there value, where are there business models or business opportunities in this that haven't yet been uncovered, and how can we uncover them and activate them. And so that's where our focus is. But we've also brought in a number of other partners that are that have their own ideas and priorities. So that's just the Toilet Board Coalitions in this space. Moving to slide 21. And so this is actually really work, and Michael may recognize a lot of this language because he was very integral in helping to develop it over the last few years. But at a baseline, what we're looking at when we think about smart sanitation and public health is what humans are producing an abundant source of health data every single day through their feces and urine. And right now, aside from when you might go to a doctor and they run a very specific, test on it, right now we're not capturing or understanding any of that. And as we look at some of the global trends around healthcare in terms of, personal fitness trackers, more investment and attention to preventative care, and then particularly, of course, with the pandemic, a greater importance and understanding of the value of public health monitoring, and that we are really a global community, and the need to understand our public health and a community's health. And the earlier that we understand it, maybe the quicker and better we can intervene. And so that's kind of the principles that this is built on. As it says on slide 21, to put this in perspective, if all 7 billion people in the day contributed just one data point per day per year, it would yield a database with 2,555 billion data points. So we're talking about an immense amount of information that is literally being flushed away every day. So also to just note, at the Toilet Board Coalition, we are looking at this from a public health perspective and advocating very strongly that this be developed specifically in a public health context with very important safeguards developed for vulnerable populations, for data security, but that this is such an opportunity for us to have way more understanding of what's going on in a community's health than any other mechanism. And so that's kind of our take. Of course, we do recognize there is a commercial opportunity here, and increasingly we are seeing toilet manufacturers and other, sort of smart device manufacturers tiptoeing into this space to see what's there. But for us, we are entirely focused on developing the public health channel of this work. So for this world, sort of a smart sanitation public health marketplace to exist, there are three components. So the hardware, the sensors, and the detection and or sampling. This is where we're seeing rapid development. So most of the entrepreneurs, the 45 entrepreneurs in our portfolio, are now integrating sensors and analytics and a sort of digital offering to their toilets. And that is a very different scenario than we had even 3 years ago, I would say. Part of that has been accelerated by the pandemic and remote monitoring, the need for remote monitoring and automated cleaning and things like that. But it was also just, entrepreneurs, particularly in the sanitation space, are very creative, very adaptable, and very innovative individuals. And so they're quite open to technologies and understanding, creating a better user experience and seeing if there is more value there that could be derived from the sanitation system. The second big component is software, so data processing and analytics, and this, I would say, is there. The potential and the programs and that sort of thing, this is not slowing us down. And then distribution, physical and mobile connections. This is also, there's sort of a convergence happening in this space. We'll get to in a few moments what we think is holding us back. But to slide 22, and I'm not going to spend too much time in the next 3 slides, but how might these pieces fit together? So just some use cases in the event that it's not clicking. For instance, a seasonal flu vaccine is developed each year based on research conducted in collaboration with the WHO about which strains of influenza virus are most likely to be common that year. So monitoring several sources of public sewage data for virus strains would provide a strong source of valuable information that could inform the development of more effective vaccines. Slide 23, de-identify their individual population monitoring. So this could be a case in, for instance, a residential or a public toilet, and you could look at, what are the nutrient deficiencies, for instance, like vitamin C in a community, and then you could run a public health campaign to encourage vitamin C and distribute vitamin C, and that would be a way to help preventive care, rather than waiting for the individuals to get more sick and then come for a checkup or come for a test. You're intervening at an earlier stage. Then potential use case 2 there is more about how this could work for a pharmaceutical company. If they're interested in, they could run those trials, or they could work with a community in a different way to understand that. We're seeing this actually. There's an incredible company. It's based in the U.S. and came out of MIT called BioBot. So pre-pandemic, they were looking at opioid usage across cities, because often when a city finds out they have an opioid problem, it's too late, and it's when the individuals are showing up at the hospital having overdosed. And so looking at the waste streams and tracking the usage, the drug usage is an earlier way that then a city can respond faster and intervene quicker. Moving to slide 24, again, identified individual monitoring. So this could be, for instance, a number of our toilet operators, they also have a complementary business that they're running with the toilet. So in some cases, that's laundry services, in some it's a health clinic, in some it's a cafe, and that happens alongside the toilet, and it helps to support the operating costs and makes it, in some cultures where it's taboo to use a toilet, it makes it easier for individuals to approach the toilet and avail themselves of the services there. And so we have worked with entrepreneurs that have hosted a doctor in the toilet and kind of had a consultation space in their toilet operations, so that women, when they were using the toilet, could also ask the doctor questions or the nurse questions about anything they wanted, but they were in a private and safe space and didn't need to make a separate journey somewhere to ask a question. And so we see a potential opportunity there for there to be a sort of doctor's toilet. So maybe not all the toilets in a public toilet are outfitted with sensors, because sometimes people don't want to know things. For instance, maybe someone doesn't want to know that they're pregnant yet. If you installed a sort of a sensor that could tell someone that. That might not be the public toilet experience that they wanted at 10 a.m. on a Saturday. So we could have a separate toilet that was a doctor's toilet. And we actually saw Suvida, which is a toilet operator in Mumbai, India. They, throughout the pandemic, they had a one toilet that was separated from all the others, that was primarily used for in the evenings, once the rest of the facility was shut down, as a sort of nighttime toilet for individuals that needed it. But during the pandemic, they actually made that available for individuals that were sick and that potentially had COVID, because they don't have other toilets in these informal settlements. But clearly, even if someone has COVID-19, they do still need to use the toilet. And so there's some precedents happening that we think this could be an interesting model to explore. Moving to slide 25. So the commercial case, we're looking at, and have had some early conversations with health insurers, with pharmaceuticals, with digital healthcare, with those in the public health space, to see what information would be of interest or could be of interest. And then, is it feasible and practical to gather that from a sanitation system? That is developing. It is a very important question that we don't yet have a clear answer to. But we understand the social benefits and motivation for this work. But the business value of it, as I mentioned earlier, is still in development. Moving to slide 26. So what we've done in this space, in 2016, we wrote the Digitization of Sanitation, and this is actually when we started this work. We went into that paper thinking we were going to write about mobile money, and how that could transform the sector. And it's an important part of smart sanitation. But what we uncovered was this potential around public health and maybe preventative measures of understanding a community's health. So that came out in 2016. And then, as I mentioned, in 2018 and 19, we ran the Pune Project, and we published 2 reports with that. We worked with a number of partners, which you'll see their logos there. One really integral voice in this space for us, and a very incredible supporter of this work, has been the European Space Agency, which is a bit random, if it's hard to say that, but for the Toilet Board Coalition. But they are focused, the European Space Agency no longer sends individuals to space, and now one of their big focuses is how can we use space technology in a developing world context. And so they fund applications of this technology and uses for instance, satellite technology, communications, geolocation data, etc. How can that advance global goals in developing markets? And so they've been we have what's called Space for Sanitation, or Sanitation for Space, I forget which way, but partnership with them, and they provide support and catalytic funding for entrepreneurs in this space to help develop those technologies and put those pieces together. And And then in 2020, we worked with Microsoft to map the ecosystem, and we're going to come to that in just a moment. And then right now, as I mentioned earlier, we have the Smart Sanitation and Public Health Roundtable, and there's a number of projects developing in that space. Moving to slide 27, these are the 4 reports that I think would be the most relevant and the most recent, and definitely the most relevant, if you just wanted to read one piece on this, would be the one all the way on the right that we published with IWA and is focused on specifically public health through smart sanitation and digital water. That came out in a year ago tomorrow, actually. So World Toilet Day a year ago, and had some great case studies and interesting perspectives and kind of the call to action of what we think is needed in this space. Slide 28. I mentioned we did a workshop with Microsoft in June, and a big piece of this was to identify who are the stakeholders and the players in this space and what is missing. And so I wouldn't expect you to be able to read it because it's actually very small, but at the bottom of the left-hand side of the screen, there's 5 red sticky notes, and those are the identified gaps that came out of this workshop. So they are investments, structured health facilities data exchange standard, a lack of policies and for developing economies, and automatic detection solutions. And many of these gaps have actually, I would say, been bridged over since this workshop, just 16 or so months ago. Investment is often a challenge for any developing sector, but we are seeing a lot more investor interest in this space. Structured health facilities data, this is what we're trying to learn more about. I would say that is still a gap, but I know I received a message today about something, what is it, Global Health Security Index. And so we know that there's work going on by the WHO and the World Economic Forum and some others in this space. Now, the standards and policies is a really important gap, and we're really actively actually trying to build that bridge ourselves, as we felt it might be. We have a potentially unique role to play in that one. So I'll speak to that in a moment. And then automatic detection solution. So with ESA, the European Space Agency, they actually funded a challenge around this last year, which has gone really well. It's passed its clinical trial and is now being deployed in the field in South Africa in 2022 to test it there. But it's a floating laboratory that operates in a waste receptacle, or toilet resource receptacle, if you will, and can use AI and some other technologies, which are, of course, proprietary, to detect pathogens. And they've been really pleased with the extent that it can happen, but it is automatic detection, and that's a really important game changer, because if we're just sampling and sending things to labs, this isn't scalable across a system and a global population. But if there is a safe and secure way to do automatic detection in the waste receptacles itself and in the sanitation system itself, then that's really going to be a key to this working. So with Microsoft, we did some mapping of value mapping to the different potential buyers and sellers. Moving to slide 29, this May we hosted a workshop ourselves to map out, again, what has been advanced since that workshop in the previous year, and what could be the role for the TBC to play. So then coming to slide 30, what we've landed on is really that public health roundtable, and then 2 specific things. So first is the policies and guidelines. So we're working with the Institute for Technology and Global Health and the European Space Agency and GSMA, which is a global mobile operators association, to understand and develop working guidelines for smart sanitation technology, policy, ethical, and social guidelines. This is just the beginning, but what we're trying to learn from and be inspired by is a lot of the policy development around mobile money, actually. So it's a bit full circle to that 2016 report, actually. Because mobile, of course, this is very sensitive data. And so much like an individual's financial data, there needs to be a very clear standards, very clear guidelines, and probably a global regulatory body of some sort that can watch over and develop those guidelines and et cetera. So we're not the people to be that global oversight committee by any means, but we're hoping that we can start some conversations that inspire and rise up other leaders to work with us on this. And so we're working now to secure funding to develop that first round of guidelines, and there has been some work already done on this because of the pandemic and the wastewater-based epidemiology that was happening for COVID-19 testing. But looking to build on that, really integrating the perspectives and views and experiences of those sanitation operators on the ground. And so that's the second part of it. So the guidelines that we're developing will then be piloted. It's good I'm getting to the end of this. Piloted with those entrepreneurs that are in our network and some others that would be welcome to join. And then the second thing is some large-scale demonstration projects. And so that's where our partnership with the European Space Agency comes in. We're looking to demonstrate this working ecosystem and to show what is possible, because it's wonderful to talk about the ideas and the potential, but until a public health official sees that data on their dashboard, it can be very hard to believe that it's possible and to understand the impact that information could have. And so that's a big focus for us right now. So we're also in very early stages, and so I'd be happy if anyone is interested in speaking more about this. I'll move to slide 31 now. Please do feel free to reach out to the Secretariat email that's in front of you, and the team will make sure that gets to the right person. As I said, I've worked with Michael on this for years, and it feels a bit like a baby that we've been kind of carrying through and protecting and really believing in. And now we're kind of opening it to the world in a new way through this roundtable and working with infectious disease experts and those like the AMR Industry Alliance to start to think about how, what are the global and public health priorities that sanitation has a solution for, and how do we build a system that can feed into that? So that is what we're doing. I hope that was interesting. It was probably unique, at least. And again, would love to hear any questions to our email address. And Michael, I was trying to leave a bit of time if you had some questions before we need to wrap up.
I think, Alex, you covered a lot of the ground, so thank you very much. I think as a recap, what we heard today for everyone is that, one, really do think in a more comprehensive way around the world of sanitation and how it can fit in within your efforts on infection prevention. Two, we have a very diverse audience here today, over 12,000. And so as you think about how this might fit within your world, if you're not in the sanitation space, I really encourage you to take up that offer from Alex to reach them. That's the Secretariat, SECRETARIAT @toiletboard.org. And also to educate yourself, again, on their website at thetoiletboard.org. They've worked with leading institutions ranging from Stanford to MIT And they really are pushing ahead in this, and this has been in a large part because of the collaborations they have with great people. So if you're self-motivated, once again, I would really encourage that. And Alex, I think another thing that you have stated, which I thought was interesting to the audience today, is just how important the private sector can be in playing a role with this. So probably many of the people on the call today are public health officials, but those who are from the private sector, the Toilet Board Coalition is a great partner. And as you can also hear, if you're with a multilateral organization, for example, like the European Space Agency, there's scope for finding ways to work together. I also thought it was great how you touched upon the importance of data security and privacy as a parallel conversation towards unlocking the incredible power of just the data that would become available. So I wanted to thank you, Alex. And one other thing we just wanted to note here is that in December, the Weber training has more opportunities to also think ahead. One of the things that is a rising concern to the world today and is harder to defeat is the emerging fungal infections. So on December 2nd, Professor Andreas Voss from the Radboud University in the Netherlands will be having a presentation, which you can find at the website at webertraining.com. Also in mid-December, on December 16th, Professor Stephen Morse over at the Mailman School of Public Health at Columbia University will actually further talk about the rise of infectious diseases and that, COVID-19 really tested the world's readiness for a global pandemic, and the reality is we weren't ready. And I think one of the big things that you heard from Alex today is that, with something like smart sanitation, we could be really ready. We could be ready right at the outset if there was a problem. So, Alex, I wanted to thank you today, and again to, point people to the website. Yes, please.
I just realized, seeing the calendar, I just remembered. So tomorrow's World Toilet Day.
Yeah.
I encourage you all to use a toilet and celebrate and be grateful that you have one. But also, if you are interested, the Toilet Board Coalition does have 2 events we're planning tomorrow, which are free and open to the public. So one is on school sanitation, specifically looking at what is school sanitation worth and how can we work to identify more sustainable models of school sanitation. And then the second is also our accelerator graduation. So celebrating the businesses that have come through our accelerator program this year. So both of those are tomorrow. One is live streamed on YouTube and the other on LinkedIn. If you go to our website, that top banner that you'll see the first thing, and then I think there's a pop-up too, will be about World Toilet Day. If you click on that, it'll take you to the registration page, and you'll be able to join it there. We'd love to have you. Back to you, Michael. Thanks.
Yeah, I was going to point right to that. So I think that it is an incredible moment to share with others this World Toilet Day. I think also, in addition to what Alex has offered you as a chance to see that, do type it into Google. There's quite a vibrant, set of activities and awareness happening around this. And so as you think about the work that you do, know that the Toilet Board Coalition is there as one of your partners in this broader infection protection effort. We wanted to thank Paul again over at Paul Weber's company, the Weber Training, for giving us an opportunity to share this incredible insights. Alex, as always, very insightful, very helpful, and thank you for sharing. And we are going to close the session today, but we wanted to thank everyone again for taking your time and attention today. And for those who want to share this, this will be then available later at the website for those who are not able to attend live today. So again, thank you, Alex and Paul, for having us, and we wish everyone an onward good journey in battling against infection. And again, a big shout out and thank you to Diversey, Virox, Gamma Healthcare, Purell, and the World Health Organization's Infection Prevention and Control Global Unit. Thank you.
Thanks so much. Bye-bye.